You can start, sir.
A very good evening to all of you. Myself, Dr. Sachin Chaudhary from Medical Affairs Team Insiders would like to welcome you all for today's inaugural webinar for International Men's Health Week. As you all are aware, the next 7 days will be celebrated as a Men's Health Week all over the world. And even we as an organization are always being committed to the male sexual health. So living up to our commitment, we brings to you yet another exciting topic to discuss, that is men's health, reviving the lost narrative. So to begin with, please allow me to welcome the moderator for today's session, Professor Dr. Deepak Jumani, the name which actually requires no introduction. He's a senior sexual health physician and counselor, the American board certified clinical sexologist, one of my favorite sexologists from India. He's been attached to Sir J.J. Group of Hospitals and Grand Medical College. He's been the course director and mentor of fellowships in clinical sexology, which is by MUHS. He's been the co-chairman of IMS initiative for sexual health. Then he's also been an author of one of the bestseller book, that is The Sex Has No Expiry Date. So please welcome Professor Dr. Deepak Jumani, sir. With that, I request Dr. Deepak Jumani, sir, to please take it ahead.
Thank you, Sachin, for this wonderful words. A very, very warm welcome to my respected and beloved teachers, my guiding guides, friends, colleagues, ladies and gentlemen. A very warm welcome to the inaugural celebration of the International Men's Health Week, which begins from today to the next week, end of this week, 20th of June. The health status of males in most countries world over is generally poorer than the females. Take an example of diabetes. Men suffer more than women, which means there will be more complications of diabetes in men like amputation, blindness, nephropathy, and erectile dysfunction. More males die at every stage through their life course. More males have accidents, suicides, and many lifestyle-related health conditions. In 2002, myself and Dr. Rajeev Sood attended the Second World Congress of Men's Health, which was held in Vienna, Austria. Here, we saw that there were 6 leading men's health organizations joined together and decided to run international events in June each year. So the Vienna Men's Health Declaration says that we need to recognize men's health as a critical issue and that there are health issues which only affect men. And we need to promote awareness of men's health approaches. And we need to advise them on changing the way healthcare is provided and create school and community programs and do a lot of activities during this week. IMS Initiative for Sex Health and IMS Men's Health Society which is headed by Dr. Rajeev Sood, and IMS Initiative of Sexual Health, which is headed by Dr. Bala and myself, have decided to work on challenging issues in men and debate key issues in men's health. And to raise the purpose is to raise the profile of men, their health outcomes and health needs. This is our contribution to our society and fraternity, and we endorse the strength of men and their health needs. To inaugurate this prestigious International Men's Health Week, we have my and our dear and beloved legendary figure in the field of sexual health and medicine in India, Padma Shri Professor Dr. Prakash Kothari. Thank you very much, sir, for gracing this occasion. Dr. Kothari is my mentor, my best teacher. He's one who has brought Kama Sutra on the world map and was honored with Padma Shri by the Government of India for his splendid work on Kama Sutra. And he also received his PhD from Bombay University for his amazing pioneering work on orgasm. A man who has got charisma in such that patients flock in his OPD as a mammoth crowd to get treated for their problems. He's a brilliant teacher, amazing orator, lover of ghazals, and I am really indebted to him for my life. I really thank sir for coming here, honoring us and inaugurating this IMA International Men's Health Week. May I request Dr. Prakash Kothari to say a few words of blessings and inaugurate this International Men's Health Week. Over to you, sir.
Thank you so much. Well,
It is indeed a pleasure for me to be among you this evening. And I thank you, Dr. Jumani, for your remarks about me, and you, ladies and gentlemen, for endorsing them. But indeed, men's health needs a proper attention. There are no two doubts about it, as do women's health. Linguistically, the word woman, that is WOMAN, has always incorporated men. And similarly, the word female conceals a male within it. This itself suggests, though indirectly, that men's health is as important as women's. Well, when I asked Dr. Sood, my old friend and my Delhi representative of the most stupendous, successful conference of, Seventh World Conference of Sexology, that why ask me, a sexologist, to inaugurate this men's health? He brilliantly replied that, look, Dr. Kothari, a man's sexual constitution is a part of man's general constitution. Hence, there is a considerable truth in the dictum. A man is what his sex is, and a woman is what her sex is. There are no two doubts about that. He is absolutely right. At the same time, I would also ask that how much time do we enjoy orgasm? How much time do we enjoy orgasm? Not more than half a minute per week, and not more than half an hour per year. But still, it's an important phenomena, for the man's misery and happiness chiefly depends upon this. There are no two doubts about it. Well, I take this great pleasure to inaugurate this webinar of International Men's Health Week and wish all the success to you. Thank you for inviting me. Over to Dr. Jumani.
Thank you very much for the kind words and blessings, sir. We also have with us Dr. M. Balasubramanian, who's a former president of Indian Medical Association Tamil Nadu branch. He's also the chairman of IMA's Initiative for Sexual Health. And along with me, I'm the co-chairman, and he's conducting a fellowship course in sexual medicine in Chennai. Thank you, Dr. Bala, for gracing this inaugural webinar. I would also request you to please say a few words of blessings for this seminar, this webinar.
Thank you. Thank you, Dr. Jumani, Prakash Kothari sir, and Dr. Rajeev Sood, my humble wishes to both of you. And it's nice that Jumani is arranging this Men's Health Week program today. Is being inaugurated today, and it will be celebrated for a week. I keep my other comments at the end of the Dr. Sood's lecture. Thank you.
Thank you, Dr. Bala. Thank you very much. Without much ado, let's come to our business of the day. The lives of men and women are equally important, and everyone's pleasure is everyone's right. The expression of every human is a choice, and this was done beautifully in the yesteryears, as it's depicted on the sculptures of Konark, Khajuraho, etc., and many other places across the world. Kama Sutra was written by Rishi Vatsayana thousands of years ago. And this expression of freedom and the choice to express their joys and pleasures is the narrative which we have lost over the passing years. And this needs to be revived. To do this honors, we have with us one of the brilliant neurosurgeon of our country who has a deep passion for sexual medicine. Dr. Rajeev Sood is a Dr. B.C. Rai awardee. He's a Dean of RML and Atal Bihari Vajpayee Institute of Medical Science and heads the Renal Transplant Division. He is totally service-oriented, his service to humanity and medical fraternity. He has been 3 times the chairman of Service Doctors Cells at the Delhi Medical Association. He has been 2 times chairman of the Service Doctors Cells of the IMA headquarters, and he's received more than 100 national and international awards. Even during pandemic, he is a frontline corona warrior. He himself suffered from corona, but he never stopped fighting against the corona pandemic. and he was helping every medical person, every patient in his hospital to get rid of corona. He is a brilliant neurosurgeon and a passionate orator, teacher, and a great guiding friend. Friends, put your hands together and welcome Dr. Rajeev Sood, who shall be speaking on Let's Revive the Men's Health Lost Narrative. Over to you, Dr. Rajeev Sood, sir. Sir, unmute kariye.
So you need to unmute. Yes, sir.
Thank you very much, Dr. Jomani, for your wonderful introduction. And I'm delighted to have Dr. Prakash Kothari, the lighting force of sexual health in India, and also Dr. Bala Subramaniam, who has guided it to be imbibed as the teaching branch, a new medical faculty, the sexual medicine, the new medical specialty. And now we are here, as Dr. Jomani also shared with you, that 2002 in Vienna, we thought that why not India? In India, we were running the prostate clinics, the prostate disease awareness program, sexual medicine, all the activities were going on. But we were so impressed that we thought that this men's health initiative should also become the part of Indian scenario, Indian, and I work for that along with all my colleagues. Some of these are with us, and in ultimately we were able to get it accepted with our modules by Delhi Medical Association, by Indian Medical Association, and Indian Medical Association has a separate national standing committee for men's health. And this week we are observing every year. And let us start our proceedings for today. These are more scientific nature, because the narrative is loss of men's health in 3 millenniums. We are talking first millennium, it was only men's health. Year 1 BC to 1000 BC, or maybe before that, 1000 BC to 2000 BC, that is the second millennium, has seen the growth of various systems, Ayurveda, Unani, Arabic, Chinese, and everywhere sexual medicine or male sexual health was dominating. Even female sexual health was not there. And now there is a new era where we have now entered. This is the 3rd millennium, and this is the story of 3 millenniums. And now we are struggling for reviving the lost narrative of men's health. As I have mentioned, that first 2 millennium, and also till 200 years back, men's health was mainly the main health topic, and it was in the forefront. And you all know that in 200 years, last 200 years, we have lost this initiative. Now, where we stand in India, we are on the path of developing countries, and there is a rapid urbanization also and rapid aging also. And any country who has more than 60-year age population, more than 7% is aging nation. And you know that we have entered the era of aging nations. And now we are aging nation, and it is feminized gray nation. Why? Feminized, not only India, almost all the developing countries. What happens that when we are born, we are dominating the female gender, and we are more in number. In fact, at conceptualization, in conceptions, at that time, more male conceptions are there, but throughout pregnancy, there are abortions of male fetus. Stillbirths are more of male. In the infant deaths are more of males. And ultimately, by the time we reach 8th decade of our life, the whole ratio is very badly reversed. And before we become the rich nation, we are becoming gray nation, and our old population, elderly population, is dominated by females. Why men's health is neglected is very important. That what happened actually because of the activism of female organizations, NGOs, and also because women at the old age who were men was dying early, it was overpopulated by women, the old women, dependent women, GDP was low because of the unemployment, lower education level, more widows in the society, in the elderly society. It was thought that there should be the movement for women because women is socially deprived and men is physical health wise deprived, and men suffer more and die early. Men is affected more than women by metabolic disorders, and the whole image of men is totally changed over these millennium. And now what is happening, the older perspective was that men health is considered only from sexual perspective. Men considered in the past and portrayed as a stronger sex, and lack of awareness about the aspects of health and poor recollection of the data. There is no data, there are no guidelines, and you will see that there is total ignorance about men's health, and that's why there was need of creating this awareness society database and health reports, men's health reports of the country. US has done it, UK has done it, Malaysia has done it for Asia, but India we are still in the process because we have lack of published data which is concentrated for men. And India aging is experiencing the phenomena of feminization as in aging, whatever is happening in other countries. And you know that various countries now because of this aging has reversed. Recently, China has reversed to 3-child norm because whenever growth rate of a country falls below 2.2, it is 1.4 in China, 1.4 in the USA, and also in Japan it is very low. European countries it is low. They are now all advocating more children because they want younger population. China is looking for younger population, and this is all happening, but India's growth rate is 2.2, and we have not reached that stage. We have to handle the situation of aging and feminization of aging, and that is because of the poor men's health, early death of men. And this is basically, I have already told, 2/3 of the world's oldest population, 2/3 is 85 years and above. Longevity, other than a country like Qatar, where men is living 2 years more than women, most of the countries, men, it is average is 5 years early men is dying, but in Russia and their countries, that men's life is 12 years shorter than female. So it is a serious problem, and we have to handle it carefully. Life expectancy in India versus rest of the in male versus female is 3 years less, and in other countries it can be 5 years or 7 years, and I have already told you that what is happening or what are the reasons. So increased genetic susceptibility is there. Stress of the being the provider of the family, whole onus of family care is on men mostly. Increase risk of metabolic syndrome components, associated risk factors of high risk behavior, professional hazard, because you know that high risk, whether it is war, whether it is high risk professions, everywhere men is employed, more occupational hazards are there, and therefore men also die early and suffer more. Genetic bases are there. Actually, it is not that a man is more involved in the risk taking, but a male is genetically and biologically fragile to start with. The X chromosome is more stronger. And what is happening, the mutations are 3 to 6 times more likely on Y chromosome, and the 2X chromosome beat X and Y pair of male sex hormones. And this is a great news that we have to address this situation, that we are genetically weak when we are born. And what is happening in our X and Y? You see there are 3,000 these 3,000 genes on X, and how many are on Y? Only 50. And whatever genes are there, all genetical diseases are transmitted, carried in the generation, mostly by the Y chromosome. So this is very important information which we have to handle, and therefore male is also considered. What is happening in Y? This chromosome is becoming smaller and smaller, and it is estimated that males may be the endangered gender on the verge of extinction. There are some animals where there is only hermaphrodites are born, and there are sex differentiation is not there, and whenever sex is required in the life cycle, they are differentiated into male and female. And same thing happen in male in womb or female in womb. You cannot differentiate before certain weeks in the pregnancy, and this is increasing, and ultimately the size of Y chromosome is decreasing. It may disappear in 100 million years, because this size difference has occurred in 300 million years, which the research has said. And it is very surprising when I sound surprising sounding statement when I say that man is likely to get extinct. Man is weaker since inception, and the immune system is weak. When the man is born, the boy is born, male boy, and female is born, newborn female is 3 week equal to 3-week-old male, and that is why there are more intracranial hemorrhages, there are more respiratory infections, pneumonias, or in the newborn males, and they die. Many of them die, and that is what I was referring earlier. And they are more vulnerable to the neurological and motor impairment and damage also. And in the psychiatric illness also, males are more affected. In autism spectrum also, 3 to 10 times the disease is more in male, and Asperger's syndrome is 10 times. You see all the diseases. These are the common diseases we are facing, like from lifestyle diseases, like coronary artery, CVA, cancer, all are more in male, and COPD. COPD, it is becoming very important in corona times. And what is happening, 80% of the corona patients are male. So it may surprise you. And also there are patients who are of AIDS, hepatitis B, C. They are 2/3 of male and 1/3 only are the females. And you see that even tuberculosis and other infections, psychiatric illnesses, suicides, homicides, all cause mortality at the bottom. If you see, it is 951 to 677, a huge difference. Now I am just showing you that in different countries, these are the blue and red bars, and red is for female. Cardiovascular burden more in male, hypertension more in male, higher risk of CAD, triple vessel disease in male, diabetes more in male. So which disease is left? Cancer more in male, and outcomes of the cancer treatment worse in males. Lung cancer, if it is in male and female, and male suffer more, and when the treatment is given, the outcomes are better in females. They are worse in males. So on all aspects, male is suffering. Dangerous occupations, I have already listed. They are in my trauma department also of RML hospital. We tried to do a small study. We thought that these dangerous occupations or road traffic accidents, they are one main differential we are observing. So let us see infants. These small less than 12-year-old children and pediatric age group. The trauma, when we estimated there in our study, small study, it was found that 2/3 of the trauma was for the male child. So this is more in male, and for the reasons you may say the hormonal differences are there. They are more aggressive. They are more. If at your home also you want something to be done, you will tell your male child to do that difficult thing to do. You will not ask the female child or your daughter. So man is more susceptible to suicide also, and it is happening in doctors also. More male doctors are suffering from psychiatric illness, and they are committing suicide. It is 4 times in male compared to female. Smoking, substance abuse, and this is the cause where Russia, the male are living 12 years shorter. It is in male alcohol consumption, the same problem. Diseases epidemic like corona. I'll come in detail for corona because this is the current pandemic and relevant for today. And these are whether diarrheal disease, infections, diarrheal diseases, cholera, acute lower respiratory infections, or neonatal tetanus. All are more in male. And also COPD, 90% in males. Tuberculosis, more common in male, and all other problems. Sex-based differences in the infectious disease are unexplainable otherwise. I have told you the hepatitis B, C, HIV, AIDS, and corona. All are 2/3 to even more, 3/4 in males in different series. So what is happening when we are talking, let us finish it. What is happening in the corona period about the sex and the population? Sex, because we are talking about the sex. What is there any difference in the outcomes? Is there any difference in the risk factors or in the corona pandemic? And you see the implication of sexual activity in the COVID pandemic. When it has been studied, the coronavirus are not typically sexually transmitted, but yes, sexual activity is important because social distancing and other things we are talking about, but it is not that it will be typically sexually transmitted disease through semen and all. And coronavirus, there has to be therefore do's and don'ts, and sex should not be the priority. If you can have the alternate modes satisfying you, you should practice that. And also there is various myths and misinformations. They are to be addressed, but one thing is sure, that expecting people to abstain from sex during times of isolation is unrealistic. This is long pandemic, and you expect that people will refrain. That is very difficult. And what you can do, you can do the counseling, psychological also addressing is important. Mental health is also suffering. Minimize the number of sexual partners, avoid partners who have symptoms, avoid kissing, avoid sexual behaviors, and fecal-oral transmission is there. So this oral or anal sex should be avoided. Condoms, dental dams, and wash which can be used. Wash your hands and shower before and after sexual activity. Wash sex toys, or use soap and alcohol wipes to clean the area where you have sexual activity. So these are some precautions we should tell people, and we should be open in discussion. And also there are various non-conventional intimacy measures like erotic messages, chat rooms, spooning, mutual masturbation, watching or reading erotica, or watching your partner. So actually you have to divert from, and you have to do the corona appropriate behavior. And this is very true that what we know that we are not going to get, we have more, we want to, if we know that we cannot get it, we will like to have it. So sex is no exception. And now coming to the disease part, gender differences which we are today talking about, the male and female, the outcomes are different in COVID, and most biomarkers are associated with severe COVID, and they are related, they are found in male. So many studies, in thousands of studies, where the biomarkers of liver, biomarkers of pancreas, biomarkers of lung, biomarkers of in even vessels, they are, when studied, even hormones, it has been found that they are more severe is related to male, and even ACE2 receptors are down-regulated in females, and therefore more severe corona is in male. And future studies are not done on vaccines or what is the difference response, male versus female, and these are the important factors which time is coming and people have started talking about it. And there are different sex differences. I have already told. Immunity, I told, at the birth is stronger in females, and therefore it remains strong throughout the life, and there are immune related protective cells are more in females compared to males. And also there are these sex differences. I'll not go into detail about ACE2 receptors and similar receptors. All are down-regulated if they are causing severe disease in females. And these sex hormones, like there had been studies done that female hormones, when injected to males, like progesterone or estrogen, they are making the corona less severe. We are giving enzalutamide and second-line hormone manipulators, and they are helping. The initial studies have shown that they have helped the males by lowering their testosterone, and therefore these studies related to male and female hormones become important. And there are, I told you, cardiac, liver, and other renal functions. You know that acute renal injury, 20% of corona patients, they get acute renal injury, and in ICU, 90% of the corona patients, they get acute kidney injury, and this may continue as chronic renal failure also, and this is happening more in male. And that is also an area of concern. I told you so many studies are going on. At least 2 months back, the data was 598 studies, and ongoing clinical trials were 3,904. And in all, the male and female data is being collected. And these gender relations are very important. It decides the pathogenic mechanism, risk of infection, outcomes, and these biomarkers are being studied more and more. And what gender-based differences are there in the host immune response to coronavirus? The net conclusions are gender is profoundly studied and largely ignored in the drug and vaccine clinical trials recently. And this is to be addressed. And when we are talking about sexual health, we are talking about the outcomes of the infectious diseases. As we have found in other diseases, other infection, it is more prominent in corona, and it was not studied that much extent, but it is being studied now. And therefore, at in this cartoon at the bottom, you see that when we see the infection, the severe disease, higher mortality is in male, and less severe disease and lower mortality is in female. So this is maybe surprising, but this is important, and there are sexual functions affected. I have told you psychosexual factors are also there. But what are the physical factors? That is also important. And it is affecting coronavirus. We were knowing that mumps are there, then orchiditis will be there. In the past, we have studied many things, but now you see what corona is doing. The corona is causing the effect on sex organs. It is causing systemic effects and psychosexual. And ultimately, that is also also affecting the sex. And effect on the sex, there is viral orchitis in 90% of cases. What are going to be long-term effects, we have yet to study and observe. And also there is lymphocytic inflammation and infiltration in the testes, and it is badly affecting, and we never know that what are going to be the outcomes if the children are also affected in the time to come. And this is a serious matter. And therefore Leydig cell function is affected, blood testis barrier is affected, seminiferous epithelial damage is there, inflammatory cytokine production can cause autoimmune damage, and also the endothelial epithelium of a small vessel, that is also affected. And therefore the systemic effects also damage the testes, hyperthermia, secondary infection, hypoxia, or systemic cytokine release, and steroids and other medications which we are giving rampantly. It is called mucormycosis, and you know the mucormycosis, black fungus, yellow fungus, white fungus, that is more in males. The wards, our ward also in the hospital, the data is also showing that most of the patients of black fungus are males. So this is the male health which is becoming very, very important. And because of diabetes is also more in male, corona is also more in male, steroids are given, and their effects are more severe in males, and ultimately we are getting the mucormycosis, perfect culture, human body, the live human body. This black fungus damage the dead bodies, dead plants, dead fruits, but they have started attacking the living human beings, and that has become another epidemic. So these are all social factors I have already discussed, but there is actually baby boom also. Unwanted pregnancies, you are not able to get medical termination of pregnancies, and sometimes the protections people are not using. And initially in European countries the fertility rate has gone down, but what happened in India, we got 3.3% increase in the sexual activity. Surprising, but it is different from the advanced countries. And some studies show that increased spontaneous pregnancy rates are there, and there is baby boom in India, and it happened in the first wave in the time of Spanish flu in Europe also. Now coming back to our topic, that Indian men have sex. That is the problem, that Indian men have the least sex. Men's health survey has shown, and there are sexual dysfunctions which are more in females. Actually, I'll tell you, the European study has shown that at the age of 42, 59% of females are having female sexual dysfunction, and 42% in male. But it is more problematic when the sexual dysfunction is in male, because male cannot be the passive partner, and therefore it is problem. And male sexual dysfunction has attracted more attention. And I have told you the diabetes, metabolic syndrome, obesity, which we are saying, diabetes also cause inflammatory cytokine mediated response, and corona is also causing. So all factors are multiplying, and we are in a dire state of health emergency for male, that we should understand. And testosterone deficiency, this is not a very new topic, but there is a high prevalence of testosterone deficiency in the aging Asian population. The results have shown, and also it is being addressed. But whatever is happening, whether it is happening in the metabolic syndrome is there, or there is tuberculosis, or there is any other infection, what is affected? Erectile function or penis has become the barometer now of men's health. and it is very important, and erectile dysfunction is very important and should be asked in hypertension, diabetes, dyslipidemia, infections, tuberculosis, spinal injuries, strokes. Everywhere this has become important. So this is one factor which is common in almost all the diseases, and there had been studies done where multiple things were seen, that what is the common thing, one thing which we should study for men's health, and it was found that it is erectile dysfunction. ED study is becoming very important, and there was these all studies were done, where at the last column you see that significant comorbidities were also considered, that even prostate, Lutz syndrome, BPH, hypertension, ejaculated dysfunction, everything was studied, and these were multivariate studies were done, and it was found at the top you see erectile dysfunction. It is related to on the right hand side of the cartoon, you say you have the entire spectrum of diseases, and in every disease one thing is common, that erectile dysfunction is affected. We know that ED starts 2 years before the heart attack, 10 years before the brain stroke. So if you are not asking, or you have not the questionnaire related to sexual health in your clinic, any clinic, whether it is your hypertension clinic, urology clinic, any clinic, if you are missing this erectile dysfunction, you will miss everything. This is the barometer of men's health. And health-seeking behavior, you know, man is not concerned. It is less insured about his health, and therefore he is suffering more and silent sufferer. So problem assessment is that there is, we now understand, organized data is not there. No dedicated scientific body was there. Now we have made the body, we have motivated DMA, IMA to start this study. It is the ignorance and the neglect that men cannot suffer, and lack of funds are, and many other unaddressed questions are there. Resources, you know that resources are very low, not only in India, but you see at the last point that breast cancer received 60 million more than the prostate cancer there, and ovarian cancer 64 million more than the testicular cancer. So more resources are given, and this is your report, that the allocation of men's health. And you know this entire report, the Millennium Development Goals of 2000, when they were declared, only these 4 or 5 lines in big volume of book were written about the reproductive health. They are not caring, and our no national program. There are so many national programs, health programs in the country, but have you seen any related to men's health or the sexual health? They are all related to lifestyle diseases, infectious diseases and all. And you see that ultimately men is suffering, and men specific programs are not there. And therefore, there is every year we are having this 1 week of men's health awareness. After that, we have various slogans, like a house husband should be there, like a woman, and woman soldiers should be there. So the different countries are reacting differently. India has to react according to their social cultural belief. And also why till now the lack of specialty is there, where Dr. Bala Subramaniam, Dr. Prakash Kothari, you are here, we are fortunate that when we are talking about sexual health, it is part of that only. In sexual health, male sexual health is more important, I have told. And if male sexual health is important, and it is the indicator of almost all the diseases, right, top to bottom in the male. So they are all very important, and we should propagate the sexual health, male sexual health especially, and in the context of the male health. And these are interrelated, the sexual health and the male sexual health. More literature, more journals should be there. There are many unanswered answers now, that questions that who should practice, orthopedician should practice, or ENT, where head and neck cancers are more in male, or endocrinologist should practice, or urologist should practice. It is started with urologists, but it was discussed in Vienna Convention also, and subsequently 2016 we had the global conference in Delhi on sexual health. I was the organizing chair for that, and in this journey, we have now tried to establish that we should have special men's health specialists, and in 3 tier, like family physician, first tier, then you can cardiologist interested in men's health can spend some part of the clinic on men's health. Gynecologist can also get associated, because it is a couple problem. It is not a, and psychologist, of course, urologist is doing all the implants and prescribing medicines become very important. But family physicians are the most important. After that, the second tier, and then if somebody decide that they will do exclusive men's health practice, that is the tertiary care. So we have to develop this practice. We have to develop the health policy for India, and a committee was formed. When Dr. N.K. Mohanty was there, he was very closely associated with us, but after his retirement, the work has slowed down. What can we do about it? The teenagers midlife crisis is to be addressed. Break the Hardonian image that men is more healthy and men is more strong sex. There is a need of attitude change. Attitude today is I can do it all of my own. Men is thinking, I don't depend on anybody, I don't need anybody. But attitude should be, I can't depend on others in the society to take care of me, so I need to rely on myself. And because others, like my family, are depending on me, I really need to take care of myself. We have to make a choice which era we are living and what is we should do. And therefore, with the Professor N.P. Gupta, member of the International Society of Men's Health, and the DMA office bearers, and Justice Dave from Supreme Court, they all were present. And Jitendra Singh, our minister, who is himself an endocrinologist, who is in the Prime Minister office, they all decided to launch, we all decided to launch the Men's Health Society. He inaugurated it, and after that, in the World Medical Association, when Dr. Ketan Desai became president, his keynote address was, because I helped him prepare all the slides, he called me, and he was so much impressed in IMA that this should be taken to the World Forum, and his keynote address was on men's health. And this was a great thing that India has shown the way to the entire world, that sexual health and men's health are very important, and they need to be addressed properly. Ultimately, now in the time of the IMA president, Dr. Ravi, the new committee has been constituted, standing committee, that is also now called the National Standing Committee, IMA Committee on Men's Health. And now, earlier we thought that men is a stronger sex. Then present, we are thinking that man is more susceptible, and future is of identification, acceptance, screening, prevention, integration, specialization. So this is the need to treat it as a special entity. And this ultimately, Men's Health Project is adopted by Indian Medical Association. And this was the great occasion 2 years back when it was adopted fully and full free hand was given. And this is the president of that IMA is inaugurating it. And other dignitaries are there. I told you 3 levels of modules, training modules. We have already prepared it. Module 1 is at the general practitioner level, 2 is at the level of specialist, and 3 is the independent men's health practice. Many clinics have started. You know, Dr. Ajay Kumar has started in Paras Hospital exclusive men's health services in Patna, and similarly in Kartikeya in South, and Dr. Raman Tawar in North, and also there are many clinics, Patnaik in Bombay. So the many people are now attracted towards it, and they are following these modules, and we are preparing these modules to be popularized, and our main aim is empower the family physician, make him specialist, make him the men's health specialist, and after that he will practice maybe 1 day dedicated, 2 hours dedicated, whatever he wants to do. And already 8 modules we have prepared. The 9th module of infectious diseases, which are more in the male, we are now in the process of preparing. And the family physician, or you call him men's health expert, is sitting at the center, who is MBBS, and all other specialties. They are surrounding him, and they will send everybody after seeing, because everybody, the cardiologist doesn't know what is sexual medicine. Cardiologist doesn't know that the person is also exposed to the brain stroke. So they will send to men's health expert, will know everything. And this will be the referral system from family physician to the particular specialist, and come back to family physician in that men's health clinic. And ultimately it will be the family, he is the health expert, men's health expert. And this clinic, men's health clinic, can offer all the services, basic services, which are friendly. Advice we can give, counseling we can give, screening we can do, managing the male specific and male predominant condition, management of the sexual issues, general well-being, and information, education, and communication is the backbone of that. And health checkups, premarital health checkups are very important. I told that many diseases, because of Y chromosome, they are genetically transmitted. Executive checkup and genetic well-make, and it will become the profitable clinic for the men. The family physician will become, he will be treated, he will be confident as a specialist, men's health specialist or expert. And therefore all the lifestyle disorders or sexual disorders are going to be addressed in these clinics. And a patient workflow will be the registration to evaluation, and after that referrals, and again the education review and the references. And the patient will remain with the family physician, and focus will be on the men's health, engage in form of the sexual health, evaluate, and also explain factors and spread this message. This is all we need. Very infrastructure, the couple of rooms, liaison with the experts, liaison with the diagnostics, basic things are given, and it is not very costly. So future directions are that pledge to unite together to establish men's health as an integrated specialization, provide men's health friendly facilities, men's health experts we have to create, men's health focused clinics and establishment, and establish a dedicated integrated men's health national program. We have to talk to government to expedite it. And let us come together to deliver a continuum of care that men deserve. It is the back integration of all the specialties where we are reaching the men's health again. And therefore, let us all work together. And on this Men's Health Day, we take a pledge that we will work for men's health, and we will do everything to expedite it so that our aging population is balanced. It is not female, socially deprived women dominated. No more widows are there in our population, and we can take care of each other. And almost all the diseases can be taken care if healthcare, men's health is taken care, and females are supporting this drive. Thank you very much for this time and attention.
Thank you very much, Dr. Rajeev. You have really enlightened us as to, and it's really scary to know that we men are suffering, and we need to definitely do something to take care of our own health. It was a wonderful presentation. a thought-provoking one, especially for we males and we physicians. It's an eye-opener. And now I request Dr. Bala to please quickly say his point of view from what Indian Medical Association has to do for our Indian men. Over to you, Dr. Bala, please.
Thank you, Dr. Jumani. Dr. Rajeev Sood has narrated men's health yesterday, today, and tomorrow. And he has given all the facts, all the data to show that men suffer more than the women, and men live shorter than the women. And the widow population in various countries, including India, is climbing up. And it is high time we take care of men or men's health also. In this regard, the Indian Medical Association had already formed 2 standing committees, one for men's health and another initiative for sexual health. And both are functioning, coordinating with each other. And I can share with you, today I met the national president in person at Chennai, and he is all for starting a fellowship course in sexual medicine very shortly. Matter of 2 or 3 months, he wants to start the sexual medicine. Already, as you know, in Tamil Nadu, we have completed 13 batches of fellowship in sexual medicine, and we have trained more than 150 doctors. So in Tamil Nadu and also in few other states, we have sexologists practicing in almost all the districts in Tamil Nadu. Same thing should happen throughout India. And ultimately, we should have a sexologist or men's health specialist in each and every toilet. If not, all family physicians are trained in sexual medicine and men's health. Let us have a start probably this weekend, maybe Saturday. We will have a webinar among the faculties of men's health and initiative for sexual health, and we will formulate the modules and other administrative modalities. We will present it to the headquarters and see that we start at least by August or at the latest by September. In another 2 or 3 months, we should start this fellowship course in sexual medicine and men's health at all India level. And we have JIMA, wonderful magazine, which reaches 2.5 lakhs of family doctors. So if you spread the message that such a fellowship course is being started through the JIMA, definitely people will start joining it, and let it be 100 or 200 to start with. And we will go ahead and we will produce sexologists or men's health specialists or empower the family physician in each every toilet of India. And we need the help of all the 3 doyens, Dr. Deepak Jumani, Dr. Rajeev Sood, and blessings of Kothari sir. And we need your inputs, both in preparing the curriculum and also mentoring the fellowship students. Thank you.
Thank you, Dr. Bala, for that insight and the wonderful work which IMA is doing at this front. Before I request my teacher, my mentor, and chief guest, Dr. Prakash Kothari, to give his point of view and sum up the whole webinar and the concept of men's health, I would endorse the contribution of Zydus, because see, we are talking about men's health, men's sexual health, and they are giving us all the products which are required for improvement of men's sexual health. They have sildenafil in the form of Penegra, they have tadalafil in the form of Zydalis, they have Udenafil as You Desire, and now they've also launched Avanafil as avanext, which is very good. And to add, they have also got Cystanone, which is testosterone in the injectable forms, and also their nutraceutical, which is L-arginine and fenugreek, which is a wonderful nutraceutical for patients who've got erectile dysfunction, having low desire. Having said that, now may I request my teacher, Dr. Prakash Kothari, to give his final words as to what is the men's health narrative we need to do. Over to you, sir.
It was indeed a beautiful talk, Dr. Rajeev Sood. You covered three aspects, mainly the erectile dysfunction, the aging and how to prevent aging, and a bit about the COVID part. I would try to sum up all three in a brief manner. Erectile dysfunction, usually how it occurs. You see, brain and nerves stimulate, heart and blood vessels circulates, hormones regulates, local tissues and muscles facilitates. So any garbad anywhere can lead to erectile dysfunction. So a clinician who is diagnosing this space should be comfortable with his own sexuality and as well as the subject of sexuality. Otherwise, prescribing medicine would be like exploitation of the desperate by the ignorant. Second, you mentioned very beautiful thing about aging. There is a sharp difference between growing old and aging. You see, to grow old is progressive maturing despite a natural slowdown. But to age is pathological. Now, to prevent aging, what things we can do? What things we can have offer to our clients? Ask them to avoid 3S. That is smoking, scotch, and stress. These 3S's are not good for the man's health in general and sex in particular. If you follow this, you can prevent erectile dysfunction, you can prevent heart attacks, and you can also prevent stroke. Second thing is yoga. The pranayam can be of tremendous help because it can lead to oxygenation all over the body, right from mind to the private parts. Another thing is Ayurveda. There are three pathies which we have: allopathy, homeopathy, and Ayurveda. Allopathy and homeopathy does not offer anything for diet. In particular, Ayurveda does. Their concept is annahi aushadam, means food is medicine. They talk about rasayana. The meaning of rasayana is to retain youth and delays the process of growing old. You mentioned very beautiful things about testosterone. But if you ask me, I would give rasayana. Cow's ghee is a rasayana. But for a man who is growing old, I would substitute natural form of testosterone. That is black gram, urad ki dal. That is very rich in testosterone. The 2 katoris of urad dal with hing and lasun tadka twice in a week is sufficient to go the balance going. And when we can treat the problem without the drugs, why use the drugs? Very simple. Second thing is about COVID. I know it's a scary thing. We know that there is no cure. और बड़ी अच्छी चीज आपने बताई कि भाई जिंदगी क्या है और तासीर जिंदगी किसको कहते हैं. ये कोविड के लिए कह रहा हूं कि जिंदगी क्या है. I mean, you ended up very beautifully that there is nothing which you can do for COVID. ये मत करो, ये मत करो, ये मत करो. अरे यार, एक बात तो जरूरी है. What is important is quality of life and not quantity of life. कितना जीते हो वो जरूरी नहीं है, कैसे जीते हो वो जरूरी. बड़ा अच्छा चीज बताए. कोविड में क्या हो रहा है? कोविड ने ऐसी जिंदगी कर ली हम लोगों की. जिंदगी क्या है और तासीरे जिंदगी किसको कहते हैं? जिंदगी क्या है और तासीरे जिंदगी किसको कहते हैं? तेरा मजबूर कर देना, मेरा मजबूर हो जाओ, ये बात. Well, you should remember one thing. There is always a hope. Best thing for men's health would be a good diet, proper walking, yoga, stress-free, avoid smoking, avoid scotch or alcohol in any form. This can take you to good physical health because sexual potency is inseparable from the total vitality of the whole body. What is good for the whole body is good for sex. So, as I mentioned earlier, the sexual constitution is a part of man's general constitution. Hence, there's a considerable truth in the dictum, as you mentioned, Dr. Rajeev Sood, that there's a considerable truth in the dictum. A man is what his sex is, and a woman is what her sex is. Thank you for inviting us. Thank you.
Thank you very much. Thank you very much, sir, for that. I think you have enlightened about the lifestyle measures which we should follow. We doctors should become lifestyle engineers for our patients, which is very important. And even Cleveland Clinic says that nutritional intervention will not only reverse the existing coronary artery disease, but also halt the coronary artery disease. Whether you do bypass surgery or do angioplasty, the disease per se is not going to stop progressing. It's going to be progressing. But nutritional intervention, which is very important, can halt the existing disease and also reverse the existing disease and have you lead a good quality of life. Thank you very much, sir. And thank you, Zydus. Thank you, Dr. Bala. Thank you, Rajeev Sood. Thank you, everyone. Thank you, Sachin. Thank you, Sajal. Thank you, Shilpa. Thank you, everyone, for making this webinar one of the most memorable webinars of the year. Thank you very much.
Thank you. Thank you very
Over to you,
much.
Sachin.
Thank you, sir.
Thank you so much. So lastly, again, I would like to thank Dr. Rajeev Sood, sir, for their brilliant talk on the men's health. And let me confess that nothing could have been better than starting this men's health week with your session, sir. Thank you so much. And as you rightly said, we need to change our attitude towards the men's health and we need to take it more serious and serious. Thank you so much, sir. Again, I would like to thank Dr. Prakash Kothari, sir, and Dr. Balasubramanian, sir, for their valuable time and guiding us throughout the session so well. Thank you so much, sir. And lastly, I would like to thank Deepak Jumani, sir, for driving the session so well. Without the help of yours, it would have been possible to conduct such a wonderful and such an insightful session on men's health. Then I would like to thank our viewers for joining in. And lastly, I would like to thank all our technical team of Zydus. Thank you so much. So please be more healthy. Please be safe and take care. And we are signing off. Thank you so much, everyone. Looking forward to connecting with you again.
Thank you.
you so much.
Dr. Rajeev.
Thank you.
Thank you very much.
Thank you so much. Yes, thank you.
Thank you, Kumani. Thank you.
Thank you, Bala. Thank you, Prakash, sir. Thank you very much, sir.
Thank you.
Thank you so much, sir.
Thank you.
Thanks a lot.
Thank
Thank
you.
you,
Madam.
Doctor.
Thank you. Thank you, sir.